Good afternoon. Welcome to the first international webinar of this year, organized by Vets and Clinics by Advance. I'm Alba Martos. I'm the international vet of Affinity, and I'm really happy to share with you that today we are with Marta Planellas. She's a doctor and she's a member of the Australian and New Zealand Vet College as a feline specialist. And currently she works in the vet hospital of the University of Barcelona, as well as the vet hospital called Canis in Girona. But before starting, I would like to remind you that you can write your questions during this session on the YouTube chat, and we will answer all of them at the end of this session. And also keep in mind that at the end of this webinar, you will be able to download the presentation in this YouTube page. And in this sense, you can consult the presentation and the webinar when you want. So I think that now we can start. Good afternoon, Marta.
Good afternoon. Thank you for inviting me. I'm really happy to be here.
Thanks for sharing with us your knowledge today. And well, I think that in this session we will discuss about the pediatric patients and which guidelines we can follow with them. And first of all, Marta, I would like to ask you, why do you think that it's so important to talk about pediatric patients, and which topic do you think that are the most important ones?
Thank you, Alba, for the presentation. I'm very happy to be here, and I think that this topic of pediatric patients is important for all vets and also owners. We have to inform our clients how to manage with these patients, and they are quite sensible and susceptible to mortality. So we will try to make a point in every of these issues to be clear how we can help them to survive and have a better health in this period of life. We will treat on how immunity works at this period, how can we help them with diet or supplements to improve their life, and vaccines and their effects, and also warming protocols to keep them the most healthy as possible as we can.
So let's start with the beginning, Marta. We know that when we are talking about puppies or kittens, the immune system is really important. So can you explain us how does they acquire the immune system and how we can manage it?
Mm-hmm. Yes, it's very important to know a little bit about their immunity when they are really young. When they are born, they only have a basic immunity that works with cells. It's a very it's the innate immunity, and it's very basic. Afterwards, newborns have passive immunity obtained by the mothers. Due to the nature of the placenta in dogs, the immunity is not passed by the placenta, so they depend on colostrum intake. That's a very important point in those species, because we need that they take colostrum in order to have mother antibodies and to be protected during the first weeks of life. It's crucial from neonatal period till weaning to protect these animals, because they are very, very prone to have infections. They are susceptible to infections because the immune response is not proper. He stays with a Th2 response from gestation till the first weeks of life. And it's not after they are older, further weeks, like 2 months later, that they increase their immunocompetence. So in a neonatal patient, we need to give them colostrum, because it's in the first 24 hours where immunoglobulins can be absorbed to the bloodstream and then provide immunitary protection. After these 24 hours, the intestine, the gut, it's closed, so there's no more transference. So in this moment, from 0 to 2 months, we need to protect these patients to avoid infections because they are quite susceptible. So we can keep them warm with good hygiene, the best diet or milk, or if it's possible, natural mother milk is the best option to keep them healthy. Afterwards, there's another period from 2 months to 6 months where diet is solid. They start to be more immunocompetent. Their response shifts to Th1, so it's more effective against infections etiology. But also mother antibodies decline, so we can act there vaccinating those patients. So immunity can improve if we give them vaccines at that time. Obviously, passive immunity is crucial in those patients. They protect them for the first weeks with maternal antibodies. But there's a phenomenon. After 10 weeks, the maternal antibodies decline progressively. So there's a susceptibility window where there are mother antibodies, but they are not enough to protect the puppy. At that time, vaccines can't work because they are blocked by the mother antibodies. So it's this window of susceptibility that we have to take to account in order to program our scheduled vaccines. Okay. This is what happens. The mother antibody declines, so we need to vaccinate several times till the puppy is enough mature to develop his own antibody response. And that's important, and where we can act to promote a permanent immunity for these puppies. So after mother acquired passive immunity, puppy will need acquired immunity from natural contact or via vaccines. When there's no contact, when mother antibodies are no longer in the puppy, when we vaccinate them, we can obtain an immune response in more or less 10 days. But it's not after the second vaccine that we would obtain a memory, an immune memory to keep them really protected. So we need two contacts from antigens with the antibodies of the puppy to be protected. So that means without mother antibodies. Okay, that's why we need multiple vaccines at the early age in puppies and kittens.
Thanks, Marta. So knowing how important colostrum is, what happens when a puppy or a kitten does not have taken enough colostrum, which is the best way to improve its immune system?
Mm-hmm. Yeah, that's a good question, because sometimes happens maybe because the kittens or puppies are found in the street, or maybe the mother dies, or whatever happens, that the mother can give them enough colostrum or milk. That's we need to do something to improve their intake. So because natural milk and colostrum cannot be supplied by any other artificial supplements, it's the best way to guarantee healthy status and survival, because they have immunoglobulins, immunonutrients that promotes growth factor, that gives energy. Then that's the best way to protect our puppies, with natural milk and colostrum. But if we don't have that protection and that source of nutrients, we had to do other actions to promote puppies' health. First of all, if it's possible, we should teach the owners to assist suckling of colostrum in the first hours of living of the after birth. So first of all, assist suckling if it's possible, to be sure that they receive colostrum and promote milk ingestion afterwards. That's the main point. If it's not possible, then afterwards we need to supply maternal milk with commercial supplements. We have to avoid overfeeding, but that's a good point. And if this maternal milk is as much similar as canine natural milk, it's better for the puppy. Even though there are other options to assist this colostrum intake, in farm animals, it's very common to use colostrum banks. It's true that in canine, because in kitten there's no studies, but there's not much canine colostrum banks, but can be an option. It's a bit weird how it's obtained, because that means that a mother has no puppies and we just suckle in a more hygienic way the colostrum to keep it freeze for the next puppies that may need it. That's an option. It's not really commonly used, but it's an option. But other options in dogs that can have the colostrum is to supplement them with canine serum or plasma that can be administered orally. This has been seen that does not increase immunoglobulins in blood, but they promote puppies' health, they increase weight and gastrointestinal health. So it's quite a good option. It's easy to obtain, easy to administer to puppies because it's oral from birth till 1 month of age. That's an option. Other option is to supply other sources of colostrum. It's true that bovine colostrum can be easily found. Fine, that's an option. There's no immunoglobulins specific for dogs, but immunoglobulins in the gut, in the intestines, can promote intestinal health and help to have beneficial bacteria in the intestine. So bovine colostrum can offer energy, growth factors, and immunoglobulins to these puppies. That's an option. Another option is that it's like a promising tool. It's the hyperimmune egg powder obtained of vaccinated hens against coronavirus or E. coli. Thus, adds a good point for these puppies because it's specific antibodies directed to diseases that affect them, and also provides this energy and growth factors that have colostrum in this product. So it's a good point.
Thanks, Marta. I think that now it's quite clear which is the role of colostrum and how we can improve it. So now maybe we can move to the next phase, because we know that a key also in puppies and kittens is to move them from milk to the real food. So I don't know if you can explain us how to manage this transition from one phase to the other one.
Yeah, that this transition is where we can act more with a diet. That's a good point to take care. We know that immune system depends on the diet, so it's a great point to take care. And as we have told, these dogs are susceptible. They are in the period of life where the immune system is fragile. Also, geriatric dogs are in this have this fragile immune system, but puppies and old dogs suffer of that. This immune system is not working properly. It's true that after weaning, puppies are a little bit stronger, but they are submitted to different stresses. Change of diet is one of them. Also travels, vaccines. So they are prone to have problems with the immunitary system at that age. Also, if we consider that intestine is the huge immune organ, and that it's very common that puppies have diarrhea due to changes on diet, due to stress, we have to really take care of this moment of transition from liquid to solid diet. How can we help these puppies to have a smooth transition? The logical terms to assure an ideal diet for these puppies is to supply components that are quite similar to the milk, to mother milk. in order to make this a smooth transition. How? We should add products that are present in milk, like nucleotides, fatty acids, immunoglobulins, that would be really good for these puppies. Also, what we want is to reduce the risk of diarrhea. So adding probiotics or prebiotics can help to reduce the risk of diarrhea. Also, having immunoglobulins in the diet will help on that. And obviously to stimulate and boost the immune system in those puppies that are that are susceptible. So that can be achieved also by nucleotides, colostrum, or hyperimmune egg powder. According to studies, it's known that diet can act in the immune system in different levels. The basic level of diet and immune system, it's supplying the basic nutrients in order to have a normal development of the immune system. That's the basic level of action of a diet to the immune response. No? If we give the correct amount of protein, vitamins, fatty acids, the puppy and the kitten would be able to develop his or her immune system. The second level of action of a diet would be stimulate this immune system. This is achieved using prebiotics to promote beneficial bacteria in the gut, using nucleotides, glutamine, and other antioxidants to stimulate this immune system in a general way. And the third level is to immunomodulate more straight to generate a good protection using probiotics, colostrum, or hyperimmune egg with immunoglobulins to protect intestinal gut and also to promote this immune system. So those levels are very important of how diet can help this immune system. So we would like to give these puppies and kittens a diet that have fatty acids to promote growth and to give essential basic nutrients for the immune system. Nucleotides, that has been a very important promoter of cells and immune system. Prebiotics to keep healthy in the guts. Probiotics and immunoglobulins. So that's what we are looking for in a diet as a starter. It's true that small dogs and big dogs have different necessities in the diet. Large breed grows very, very fast. We don't want that they are fat when they are puppies, because they can have afterward, later on, problems on their joints. So we don't want overfeeding those patients. And we will have levels of calcium and phosphorus adequate for those breeds. We don't need to add supplements of calcium and phosphorus if we give a balanced diet, because we can destabilize this studied diet for them. So we have to be concerned of this puppy starting diet.
Thanks, Marta. I think that now we have more information about how to manage diet in this kind of animals. But now I would like to ask you about the vaccines, that we know that it's really important in puppies and kittens. So I would like if we can remind which kind of vaccines do we have nowadays in the market and how they work.
Okay. We have mainly two types of vaccines. We have infectious vaccines and non-infectious vaccines. We consider infectious vaccines those that are mainly modified live vaccines or recombinants or vector that use vectors. And this kind of infectious vaccines can promote the disease. Antigen can replicate and can promote the disease mildly. But the good thing is that the immune system is very nicely stimulated. One dose can be protective. And it's true that there's a slight risk of clinical signs, but we just put the vaccine in a method that it's not the infection route usually. So we use it quite commonly. It's a good vaccine to promote immunoprotection. The other kind of vaccines are non-infection vaccines. They are killed or inactivated, and they can add an adjuvant to promote their action. Because the antigen does not generate clinical signs, is not that strong in stimulating antibody response. So usually they need adjuvant, and multiple doses are required to be more immunostimulant. Okay. So we have both kinds of vaccines, infections and non-infections vaccines, that we can check in the levels of the vaccines we are used to administrate, to check which kind of vaccine we are dealing with. Also, we can divide vaccines according, apart from if they are infectious or not infectious, we can classify them according if they are essential or core, or non-essential or optional or non-core. So how we consider a vaccine core or non-core depends on the severity of the disease they are designed for, the transmissibility of the disease, and if they are zoonotic, they have zoonotic potential or not. They are vaccines that are not recommended because they are not supported of scientific evidence, like vaccine of coronavirus in cats, or the immunodeficiency in cats also.
Okay, then, well, now we have a general overview about which kind of vaccines we have. So let's focus on dogs. Which vaccination protocol do you recommend for dogs?
Mm-hmm. Yeah, we have different guidelines available that you can check if there's any doubt of that. But we have this division of vaccines in core and non-core. In dogs, we consider core vaccines the ones that are essential in any animals, independently of the way of living and where they live. We consider core vaccines that include canine parvovirosis, distemper, and canine hepatitis, infectious hepatitis. Those three vaccines are core in dogs, and that's what this kind of vaccines must be applied in all dogs, independently of their life. In some countries, Leptospira is considered also core vaccine due to his zoonotic potential, and because it's quite difficult to avoid the contact of every dog. So Leptospira can be considered core according to the risks the dogs suffer in each country. As non-core vaccines, we have other vaccines. Rabies usually also it's a core vaccine, according the legacy of each country, but obviously in endemic countries it's core. And in non-endemic countries, it's very highly recommended. Maybe it's compulsory by law, so according laws, maybe a core vaccine. Non-core vaccine typically are those that are recommended depending on the life of the dog. If the dog lives with a lot of other dogs, it's recommended to vaccine against parainfluenza, Bordetella vaccine, for example. There are other vaccines that can be suggested again, according to the life of the dog, but they are not essential. Borrelia, Babesia, Leishmania, parainfluenza are the typical non-core vaccines. So to start with core vaccines in dog, mainly the parvovirus, distemper, and canine hepatitis. This trivalent is the main vaccine in dogs. It's an infectious vaccine with a strong immune response, and it's true that each time appear new variants of parvovirus, we have to take it into account when we choose the vaccine for each dog, but we vaccine basically of these three agents. It's true that after the first vaccine, with full action with full activation of puppies antibodies, the dog can have their first contact with the outside after 7 days of the vaccine. We don't know if mother antibodies have blocked the vaccine, so that's the problem. Usually we wait till the second vaccine to be outdoors and in order to be more protected. What we used to do is starting vaccination from 7 to 8 days, 8 weeks old. In puppies, 6 from 6 to 8 weeks old, we start vaccine. And we revaccine every 3 to 4 weeks till the puppy is older than 16 weeks. We do that in order to avoid maternal antibodies and to promote puppy's own immune response. After this last vaccine, after 16 weeks, we revaccinate from 6 to 12 months. Why we do that? Because sometimes if the first vaccination is not properly performed, in some cases to vaccine at 6 months, it's a good idea in order to be sure that this puppy have enough antibodies. But usually if we perform a nice primary vaccination till 16 weeks, we can revaccinate in a year. Afterwards, vaccination, it's not annually. We can perform it every 2 or 3 years when the dog is an adult. Leptospira, even in some countries, is considered core, others not, but we support this vaccine when they are puppies, but we only need to vaccinate it twice. We can start at 8 weeks and then repeat it 3 to 4 weeks later. Vaccine of Leptospira adds different variants according to the vaccine you use. In Spain, for example, we have those variants included in the vaccine. But new reports have suggested new variants. For example, in Spain, the same will happen in other countries. So this vaccine must be on evolution, on constant evolution, in order to add new variants and protect our puppies from this disease. Rabies, as we said, is a zoonosis, so we have to vaccinate dogs and cats in order to lower the law in each country. We have to follow legally, and you can have killed vaccine with adjuvant or a recombinant form of vaccine. And we start vaccination after 12 or 16 weeks of age. So that's the first vaccine on 16 weeks of the puppy. And we can put it annually or every 2 or 3 years according on the country the puppy lives. If the dog travels, the vaccine must be applied annually. One non-core vaccine is the vaccine that protects against infectious tracheobronchitis. This vaccine is quite useful in dogs that live in shelters, or they are working dogs that they are together with other dogs, because this disease is quite infectious and contagious. So it's good to have them protect. Also, some shelters or residency homes makes it compulsory to have dogs vaccinated in order to control this disease that can be really spread between dogs. How we vaccinate against infectious tracheobronchitis in puppies? We start at 8 months, we repeat it in 3 to 4 weeks, and afterwards annually. It's similar to Leptospira. Other non-core vaccines, for example, we have vaccine against leishmania. It's a vaccine that must be applied in dogs that are seronegative, so we have to check antibodies before using this vaccine. And the concept of this vaccine, it's not to obtain a whole protection against leishmania, but to improve the immune response if the puppy and the dog finally develops this disease. So vaccination against leishmania does not guarantee that the dog won't be infected. but would promote a better immune response. We have 2 different vaccines in the market. There are different schedules of vaccination according to the vaccine you use. But after the first vaccine, it's annually. And it's important to remind that in order to avoid leishmania, repellents, it's a good point to add to the vaccination schedule.
Thanks, Marta. I think that it's really interesting to understand the vaccination protocol that we have to follow with dogs. I would like to do the same exercise but for cats. So can you share with us the same, what we can follow for the vaccinations for cats?
Okay, yeah. Also for cats, we have different guidelines that you can check to have more details in order the different types of life of cats. So I leave these articles there. But yes, in cats happens the same. We have core vaccines and non-core vaccines. All cats should be vaccinated against core agents included in core vaccines like feline herpesvirus, feline calaisavirus, and feline panleukopenia. Those are the core vaccines in cats. As non-core vaccines, we have feline leukemia, rabies, and vaccines against Bordetella and chlamydia. When we talk of core vaccines, mainly against respiratory virus like calaisavirus or herpes virus, we know that those vaccines are infectious vaccines. And against these 2 agents, we have protection, but it's not a very, very good protection. In those days that cats are vaccinated have shown that even when cats are vaccinated against this respiratory virus, the disease has not decreased on the society. That means that this vaccine helps in controlling and reducing the risks of this respiratory virus disease, but does not eliminate the disease in the areas. No? So, I mean, you can achieve a control, you can reduce clinical signs, but probably the cat can suffer a little bit of this disease. On the other hand, the vaccine that it's combined is that you can obtain a combined vaccine including feline calaisavirus, herpes virus, and panleukopenia together as a trivalent. On the opposite hand, as we saw with respiratory virus, the panleukopenia virus vaccine, it's also an infectious vaccine, but it's very, very good in promoting immunity against this disease. So it's very useful to avoid cats having panleukopenia. Very, very important in shelters where this disease can be devastating. So this is a good and very important vaccine to protect cats. In core vaccines, including this vaccine against these 3 viruses, we start the schedule in kittens from 6 to 8 weeks of age. We start vaccinating then, and then every 3 and 4 weeks we repeat vaccine till the cat has 16 weeks. That means that a cat can be vaccinated maybe 3 or 4 times because we will finish when the cat is older than 16 weeks. That's like the dog. Afterwards, we can revaccinate in a year. We have this option of 6 months if we don't know if the first schedule of vaccine is not correctly performed. If not, we can revaccinate in a year. And afterwards, vaccines are not that common in cats. We use it every 2 or 3 years if the cat is in a non-risk environment. If the cat lives in a very risk environment where there are plenty of cats, for example, shelters, vaccination can be repeated every year. Other vaccines, like non-core vaccines, are administered according to the risk of the cat. If there's a really, really high risk of chlamydia because their shelter maybe has suffered this disease before, then we recommend vaccine also with Bordetella, but only if the risk is high, and this vaccine both vaccines can be administered annually. Talking about leukemia in some areas can be considered a core vaccine, but this vaccine is administered to cats that will have an outdoor life, or maybe they will live with a cat positive to leukemia. If a cat is always indoors and they live alone, it's not actually necessary. But if it's not clear how will be the life of the cat, and we don't know if the cat will be a little bit outdoors in gardens or small areas where maybe a cat can also share the space, it's important to recommend the vaccination. In order to vaccinate those cats, we have to know if they are positive previously to leukemia. It's also good to know if immunodeficiency is there. That's why we have to perform a test. We can perform a test when the cat had been in home in a controlled environment in order to obtain a true result. I mean, if the cat is during 1 month controlled, if the test is negative, we will trust in this negative. If not, we don't know if it's a latent infection, maybe on lymph nodes, and after a week, this antigen will appear on blood. So we can have or 2 tests separate in a 2-month period, or we can keep the cat control and perform the test after the cat is 1 month control. When we have a negative result, we can apply vaccine. We apply 2 vaccines when they are puppies, from when they are 8 weeks old and after 3 to 4 weeks. Afterwards, we apply an annual vaccination because cats are very prone to have this disease when they are very young. Afterwards, when they are older, like 4 or 5 years, the susceptibility to be infected by leukemia is each time lower. But at first years of age, it's really important to vaccinate every year. We try to avoid adjuvant vaccines. We will see in the adverse effects that it's not adequate to vaccinate with adjuvant. We have other options now, so you can choose. And this will be for the cats, the schedule for cats.
Thank you, Marta. I think that it's clear that the vaccines plays a really important role for puppies and kittens. But we know that when we are using vaccines, sometimes we have some adverse reactions. So can you explain us which are the most common ones in puppies and kittens, and what we can do to prevent them, to avoid this kind of adverse reactions?
Yeah, thank you, Alba. Yeah, first of all, to say that it's true that adverse effects exist, but never they are that important to decide not vaccinating our pet. It's as there are many studies about that, and always the percentage of adverse reactions are really, really low versus the animals vaccinated and the beneficial effects of being vaccinated. So taking this into account, we can talk about adverse reactions. That it's a thing that vets are very afraid, and owners too, and we need to explain a little bit without scaring of the risks of vaccinating. We have different adverse effects. We have slight effects like fever, a little bit of malaise, that they are not feeling well. Other reactions like anaphylactic reactions, immune-mediated response, tumor induction, and other rare effects of vaccine. First of all, what we usually see is a mild transient fever that it's due to this pro-inflammatory cytokines that are induced with vaccine. So that's like a normal reaction of vaccine. This problem usually lasts 1 or 2 days, and it's like a slight fever that puppies recover easily, and you don't have to do anything about it. Other effects can be like an acute response. Usually what we can see is like angioedema or edema of the respiratory areas like glottis, and that's more serious. We had to react quickly with these diseases. When there's a skin inflammatory response, it's not that severe, but when there's facial or tongue or glottis swollen inflammation, it's important. Other reactions that we can observe are immune-related. We can have like immune-mediated reactions like anemia or thrombocytopenia, also even polyarthritis. So if we have an animal, kitten, dog usually is more common than cats, but cat or dog with hemolytic anemia, thrombocytopenia, or joint pain, we have to take in our differentials that maybe vaccination can be a possible etiology of this effect, these signs. So if this dog had been vaccinated in less than a month, vaccine can be added in a possible etiology of these signs. Other thing that worries us in cats, for example, is the induction of sarcoma associated to vaccine. This was very alarming some years ago. Now we just put methods to avoid it. And also we know that it's not only induced by vaccine. Any injection or chronic or continuous injection in cats can develop a sarcoma because inflammation of tissues can perform a change on fibroblast from inflammatory to tumoral. That can happen even with a microchip or long-lasting antibiotics or other treatments that are applied subcutaneously. So we have to take to be aware of any injection that can promote this sarcoma. It's true that adjuvant vaccines were associated with sarcoma more often, so feline leukemia vaccines and rabies were the most common vaccines associated with induction sarcoma in cats. It's really a tough disease and important. We have to apply this rule of 3 to 1. If there's a nodular mass that persists during 3 months, we have to be alert that maybe it can be a sarcoma. If it's more than 2 centimeters of size, it's also important. And if the growth has increased in a month, we have to suspect of this possible tumor. And because it's a tumor that can reappear very easily, we don't want to make an excisional biopsy. We need to make a small biopsy to be sure it's a sarcoma, and afterwards we will need image techniques to be sure the spread of the tumor and to apply the best surgical resection possible. The resection is very aggressive. We need 5 centimeter margins, and we need to take off 2 fascial planes. So we need really a huge surgery to get rid of this tumor and to be curative. If not, if we don't take it out completely, it won't be cured, and we will need other therapies to beat this tumor. So when we vaccinate a cat, we have to think about the beneficial point of being vaccinated and the risks. And we will try to avoid adjuvant vaccines. And it's important to vaccinate subcutaneously in order to detect possible nodules easily than if the vaccine is applied intramuscularly, that would be deeper and difficult to detect possible nodules. It's true that cats, now that we are more aware of the risk of having sarcoma, we have a schedule in order to vaccinate cats in places where, in case of sarcoma appearance, we can make a wide surgery assuring curative effects, like in the legs. So we try to avoid interscapular area. Sometimes it's not possible because the cat is not very collaborative and you have to vaccinate them. But if it's possible, we will try to vaccinate on the legs. On the right front leg, we use trivalent. On the rear legs, left for leukemia, right for rabies. This aids us to detect nodules and to associate these possible sarcomas to vaccine administration. Okay. Other rare adverse effects of vaccines are, for example, this hypertrophic osteodystrophy described in Weimar runners, and also interstitial nephritis associated with vaccines in cats. There's a paper that associates vaccination and dental disease to risk factor of chronic kidney disease in cat. That's interesting because maybe this stimulation of antibodies can induce renal disease in cat. That's an interesting point. So we will minimize the vaccines. And also another possibility that this interstitial nephritis can appear in cats, it's because some vaccines use renal cellular cultures, and maybe this presence of these cells can promote nephritis. It's not that common, but it's interesting to be aware of that.
Thanks, Marta, for this clear explanation. Last question we have, it's about parasites that they are affecting dogs and cats. So maybe we can finish this session talking about these parasites, which are the most important ones, and how can they affect our puppies and kittens.
Okay, yeah, this is an important part also to take care of our puppies, because being parasite, I mean, if the puppy has parasites, they can have a less potent response to vaccine, and their immune status can be affected. So if we want to have healthy puppies and kittens, we need to deworm them. We can have different kinds of parasites. We can have cardiorespiratory parasites like Angiostrongylus vasorum in dogs. Dogs that eat snails are prone to have this parasite, and cats that hunt or eat lizards, mice, or birds can have Allostrongylus abstrusus. In the case of cats with Allostrongylus abstrusus, it's quite common parasitosis of the pulmonary area, and it's a great differential of cough in a young cat. Other parasites, gastrointestinal parasites, are present in puppies. There are huge amounts of different kinds of parasites that can appear in puppies, like roundworms, tapeworms, or protozoos. So a nice point is to perform comprologic analysis in order to define which parasite our puppy has, because the treatment is a little bit different according to the parasite present in puppies. It's true that nearly all puppies are infected with parasites that can be transmitted via placenta or milk. If mothers are not properly dewormed during pregnancy, it's quite common that puppies are infected. So the deworming schedule, it started very early. We start when the puppies are 15 days old or 3 weeks old, more or less. And we repeat it in 15 days, and afterwards we deworm them every month till they are 6 months old. Afterward, we can deworm in a schedule of every 3 to 4 months. But when they are puppies till the 6 months, it's important to deworm them every month. Also, puppies live very close to us, and that's a risk for our health because there are zoonosis. We can share parasites because we are really in touch with them. So it's very important to have them dewormed. There are parasites that that have an important zoonotic potential. So be sure of a proper deworming schedule is important, and also analysis of feces in order to know with what we are dealing. It's important also to keep these kittens and puppies free from external parasites, because there are worms that come from fleas, for example, dipylidium. So we want to get rid from external and internal parasites. When mentioned to this disease, trichomonas in cat, it's important because sometimes we don't think on this disease, and it's like driving us mad. Why? Young cats can have large intestinal diarrhea in a chronic way. And usually we perform normal tests and they are all normal, no worms, no abnormalities on fecal culture, no abnormalities on blood test, and it's like, what's happening with this cat that do not respond to diet and everything? We have to be aware that young dogs, usually pure breeds that came from breeders, can have this liquid mucous diarrhea with chronic signs. It's so inflammatory in the final part of the intestine, even we can see rectal prolapse, and we have to think in the presence of trichomonas. The issue is that this protozoa must be diagnosed using PCR, so we need to send a fecal sample to look for that protozoa. It's true that the bad thing is that it's like a chronic disease, quite annoying for the owner and the cat, but the good thing is that used to be self-limiting, and in a year or two, probably the cat will stop having these problems. But how can we help those cats? Obviously, we can use a multifactorial treatment using probiotics in order to restore flora, prebiotics with fiber, soluble fiber like psyllium, in order to reduce inflammation in the large part of the intestine. And we can support them with metronidazole. Metronidazole, that's an option. But the drug that acts directly against trichomona is ronidazole. Ronidazole can be toxic, can have brain toxicity. We should alert owners of that, but used carefully, it's an option. So those cats can be managed with diet, fever, and probiotics in a long way in order to protect this intestine and to promote rehabilitation. Okay, that's an important disease to take into account in cats too. So with this, we finish the main points to take care of our puppies and kittens. So thank you for the audience. Thank you.
Thank you, Marta, for your explanation. I think that now it's time to move to our questions. I think that we have several ones in our chat, so let's connect to our questions.
Thank you. Happy to answer.
Hi, Marta.
Hi.
So let's, I think that now we can move to the first question that we have received during our session. The first one, it's about how many kilocalories does a puppy or kitten need when we fed them with milk supplements? Can you help us with this question?
Yeah, usually this is difficult because the main thing is to follow the brand, what the brand suggests you about kilocalories. But sometimes if you have to count how many kilocalories they need, you can use the formula of rest energy requirements. And puppies used to need like 3 times the rest energy requirements used by the formula, so you can calculate the kilocalories. And when they are older, from 0 to 4 months, they need 3 times the rest energy requirements. We can calculate that with a formula that we can find everywhere with the weight of the puppy, and this can aid us.
Okay, many thanks, Marta. The second question is about what additional vaccines we can give to the cats that are living indoors, but they are living with a dog.
Usually when cats live indoors, they don't need that much vaccines, even if they live with dogs. They use not to share disease except of Bordetella bronchiseptica and also Leptospira. So those diseases can be considered, but if the dog doesn't have, if in the house there's not a big amount of animals, it's not really necessary to vaccinate the cat with Bordetella bronchiseptica, neither Leptospira. So I would follow the usual vaccines as we perform in a normal cat.
Okay, I think that it's clear now. And the last question we have, it's about if it's possible that vaccination causes steroid-responsive meningitis and arteritis for dogs, because well, we have a steroid.
Can you repeat again?
Yes, the last question is that if it's possible that vaccination in dogs can cause steroid-responsive meningitis and arteritis, because well, there is one attendee that says that some clients they treat the dogs, and then it seems that when they vaccine the dogs, this problem comes again. So maybe it has some relationship with the vaccination.
It's true that vaccination can make like a starting disease, immunomediated disease. It can be the starting point. And we have seen polyarthritis related with vaccines. So if an animal suffers of a disease that it's immune mediated, it can be worsened if vaccine is added to the treatment as an annual treatment. So those animals should be notified by a vet that maybe they have not to be vaccinated if they are ill. And if the animal is not ill, the disease can appear, this steroid meningitis or polyarthritis, because there are descriptions of immunomediated diseases associated to vaccine. Usually they are not that severe of a primary immunomediated polyarthritis, for example, but they can appear. So if a dog had been vaccinated or a cat, usually that appears more in dogs than cats. 1 month before these signs appears, it can be considered that vaccine can be a possible etiologic agent. But yeah, when we are dealing with animals that have this kind of disease, it's very difficult to decide if they need to be vaccinated or not. The risks had to be considered, but if they do a normal life with no many risks, usually vaccine is not advised.
Okay, many thanks, Marta. I think that well, it has been really helpful for all of us. And now we are at the end of this webinar. I thanks all the attendees that we have here today, and I encourage you to follow us in our Vets and Clinics YouTube channel, because we will have more webinars in the future. And well, as I said, I hope you have enjoyed this session, and I hope to see you come back. Thanks very much.